Full Circle Fitness is sponsored by Circle Health Complete Connected Care.
Hello everyone, my name is Will Courtney. Welcome to Full Circle Fitness, brought to you by Circle Health. With this show, we hope to bring you health and wellness information from our experts at Circle Health to help you and your family live a healthier life. Today's episode starts at the beginning of life and caring for newborns. With us today are Federico and Amy McCabe, registered nurses from Lowell General Hospital's Mother-Infant Unit, which is where the babies go after they're born. We'll be right back with our guests. Okay, we're back with Amy McCabe, Federico from Lowell General Hospital. Thank you guys for coming. And maybe you could start out by telling us a little bit about what you guys do at the hospital.
Sure. So again, my name's Amy. I'm the pediatric and newborn educator at Lowell General Hospital. So I provide education to the nursing staff in the special care nursery, the newborn nursery, and also the pediatric floor.
And I am the clinical manager of the Mother and Infant Unit and Lactation at Lowell General Hospital. So we are the postpartum unit after the mother has delivered her babies.
And a lot of what you guys do is education, right? Teaching parents who might wish their baby came out with a set of directions.
Yes.
And unfortunately, it doesn't work that way. I always say there's billions of babies, and yet for everybody it's the first time. And so so we're here to talk a little bit today about sort of things to think about to keep your baby safe, to make sure it has a safe environment, and maybe sort of change some misconceptions once you get all these blankets and stuffed animals from the shower and everything, that there's different things you want to think about to keep your baby safe, right? Why is this stuff important? Why is this important to get out and talk to people about this?
I think that there's a lot of misconceptions, and I appreciate us being given the opportunity to come here and speak about it, because I think it's important on our unit at Lowell General and Maternal Child Health. We don't treat or teach just the mother, we teach the whole family. And those misconceptions are the grandparents' ideas, the in-laws, it's everybody. So we really teach to everybody in the family and really look at it as a family unit, and what can we do to change beliefs without hurting feelings and saying that they were incorrect. And evidence has shown, and we can provide that evidence, that what we're teaching now is safer for the infant, and that's the most important.
And what we're trying, but one of the things we think about, it's called SUID, is that right?
Yes.
And what does that stand for?
Sudden unexpected infant death.
Okay.
And it's actually an umbrella of many different elements underneath it, SIDS being one of those elements. And our program that we just, we're working with right now is promoting safe sleep, a safe sleep environment. Mm-hmm. And that is to help prevent those instances of SIDS or SUID.
And so I'm sorry.
There's actually about 3,500 deaths a year, unexpected deaths while infants are sleeping. So we at Lowell General have taken the initiative to work with the organization called Cribs for Kids. And through that organization, we were just recently recognized as gold standard for having taught our families and our maternal child health departments the best way and what's best practice for our babies to sleep and what type of environment they should be sleeping in. So we're very proud of that accomplishment.
So you got the gold award, right?
Yes,
We did, yes.
And now was Lowell General the first in the state to get
We were
that?
the first in the state of
We were.
Massachusetts to achieve that. So there's, it's a big accomplishment for the hospital. We have pediatricians involved in it, neonatologists, staff, everybody from our housekeeping to all the way up to our doctors. Anybody that walks into a room can speak to our safe sleep environment, and that's what we're really proud of.
And again, a lot of that has to do with that education piece of it and
Yes.
educating every family. So we have here today some props that we can help people sort of see what we're talking about.
Do you want to hand me that sec?
Sure.
Will, and I will talk about this.
That'd be great.
So part of our Safe Sleep program is all of our infants, when they're in the hospital, will be using a sleep sack. So we start the sleep sack at 24 hours of age after the infant has had their his or her first bath. And this sleep sack is a swaddle, and I'm sure many families receive these for gifts. We were never, we had never used them prior to in the hospital, so we just started in March, I think it was.
Yes, just a couple months ago.
And instructions here on how to swaddle, so we can, again, when we're in the room with the patient, in the families, we can show them a visual as well as speaking to it. And it's a nice sleep sack. The zipper's at the bottom. We put our infant in, and that's just to keep it stabilized. And then we swaddle the baby up in this. So Amy can speak to about the teaching aspect of this.
So what the teaching point we really like to stress when we're talking about the swaddle and teaching families how to best utilize the swaddle wrap is that the swaddle really should be weaned by 2 months of age. So before the baby becomes of rolling over age developmentally, around 3 to 4 months, we want to make sure that the families are well aware that they really should, for best sleep practices, wean the swaddle by 2 months of age so a baby doesn't inadvertently roll over early and then is prone or face down in the crib. So that's the importance of weaning the swaddle. So they could continue to swaddle for comfort, but just not putting the baby on their back for sleep beyond 2 months of age. And when you wean the swaddle, you actually don't have to wean it arms in and then all of a sudden arms out. So it's a tank top-like style. So when you are using the wraps around the side, that's up until 2 months of age, but then you could switch to just swaddling the torso, which would be, again, just around the belly and lower chest area, and then they have their arms free. You actually could wean one arm at a time, so it's not as dramatic for the babies, but you could still give that little bit of comfort and swaddle the torso.
And this literally starts from day one.
Absolutely.
So are you in the room that first day sort of helping talk to the parents and how to do this?
When I used to work on mother-infant, actually, before I was in this position of educating the staff, so yes, we would actually try to implement teaching as soon as the family arrives to the mother-infant unit.
Okay.
A lot of teaching even begins up on labor and delivery, actually, and maybe even before that, the prenatal classes that we have offered at the hospital. But so every time you walk into that room is an opportunity to teach the families, every single time. So there's always questions that come up, but they're often there with us for just a short period of time that we really try to give them the best and the most influential current best practice information we can.
I'm sure, and I'm sure the parents are eager to get it. So you're going to show us swaddle here?
Yes, so this is our typical, and many families I'm sure remember, prior to us using the swaddles in the hospital, every baby was constantly wrapped in a swaddle blanket. So the first 24 hours we are still wrapping in a blanket, and we want parents to know that you're never going to have enough swaddle blankets for the entire day because the babies go through them often. So we wanted to also teach to how to swaddle with a blanket. So we always fold down one corner.
So I always say to put the blanket initially in the shape of a diamond. If you have it in the shape of a diamond and you put your top corner down, you've now created a straight line across the top of the blanket. So I actually have a doll in here that maybe we could pull the doll up
think
real
that'd be
quickly
great.
so
Sure.
we could show more of a visual. We're going to be doing some car seat.
And we teach, again, we talk about the family unit, but our moms often can't get out of bed right away after delivery, so the dads, this is something they can do. So they feel very engaged when we sit and say, okay, this is what you're going to do, and then they master it before the mothers. So it's nice for the dads to feel involved.
And maybe it's worth sort of pointing out that the idea of a swaddle, if maybe people don't understand, well, why do you swaddle a baby right away? They want that. They want that feeling.
Correct. They came from the uterus, which was tight, and the baby was tight, so they want that snugness. It calms them down, and we tell our patients, don't immediately stop swaddling when you go home. They need that comfort. The infant, it's a soothing mechanism.
It's going to be good for everybody. The baby's going to rest.
Absolutely,
Yeah.
and mom and dad will rest.
That's important too.
This girl's in her party dress, ready to go.
Yes.
So that straight line we've created, we're going to put her shoulders just below the level, that straight line that we've created. So if you can see that, so just below. And then it doesn't really matter which arm, and each nurse may swaddle a little bit differently, so everyone's
I
experience
know, I'm waiting for you to tell me what to do.
We may do it all slightly differently, but there's a couple important points to stress, and we'll do that as we go along. So it doesn't really matter which arm you start with, but I usually go over the shoulder, over the elbow, and then over the wrist, almost kind of nestling that arm in there, almost like a little sausage. And then I pull my extra slack from that same side and go all the way across and tuck under the opposite hip. So I've now wrapped the arm, and I've taken all my extra slack and tucked it under the opposite hip. Then you're going to bring the bottom point up. Some nurses go over the side they started on, some nurses go over the opposite shoulder. So once you've brought the bottom point of the swaddle up towards the top, whether it's over the same shoulder you started on or the opposite shoulder up in that direction, you're then going to swaddle the other shoulders by going over the shoulder, over the elbow, over the wrist, and again, all your extra slack goes across like a belt, over and underneath the opposite hip. So then again,
So we have a snug baby.
yeah.
And does it'll just kind of stay, it'll stay secure?
If the baby's placed on its back for sleep, that last tab should stay tucked under. So families could swaddle with blankets like this, or they could use swaddle wraps. So either or.
Great. Can I try it and see if we
Sure
can
Absolutely.
Yes.
see if I was paying attention?
Okay.
All right.
So have you start with the blanket.
All right. So we have the diamond, and we're going to lay it like this, right?
Here's your
Take
baby.
my baby. Baby sleeping.
Yep.
So start under the arm,
Over the shoulder.
over the shoulder.
Yep, and then encase the shoulder and the elbow and the wrist, so the whole arm.
Okay.
Yep.
Yep.
So like this, and then
All your extra slack goes over, across the body, under the opposite hip.
up.
Nice and snug. I always say that how snug it should be the waistband of a pair of sweatpants, or for expectant moms, the elasticity of the waistband of her maternity pants. So that's about as snug as.
Okay. And am I tucking this all the way under?
Behind
Yes,
her. Yep.
please. Mhm.
Okay. I'm doing.
Has it been a while, Will?
It's been 3 years. And I don't think I was good at it 3 years ago.
Good, you've done great.
So then.
Then you're going to go to the
I'm
bottom.
sorry, baby.
Yep.
She's waking up.
Take
then
the point first.
the point.
Take the bottom, yep. And you, again, can go over the shoulder you started on or go over your opposite shoulder. You'll see different techniques. There you
Okay, so
go.
let's
And
try
nice
that.
and snug.
Nice and
You can tuck
snug.
that behind her. And then,
And then.
And just bring it over.
yep, like a belt. And you just don't want the risk of any loose blankets up by the baby's face.
Okay.
So we usually
So
encourage you to almost kind of bring it down. When you're done your swaddle, often it'll look like the V-neck, like a V-neck sweater.
Okay.
So,
B plus.
yeah,
Yeah,
B
a little
plus.
work. We need to work a little bit with you, Will, but that will go.
But again, first time.
Yeah.
but
Yes.
Yeah, you
Practice, practice. So
Absolutely.
parents get lots of practice.
Yeah.
So.
Absolutely.
Okay, great. And so we've got our baby swaddled, and now we want to put her in the crib, right? Okay.
So we don't want anything in the crib at all, and this is something that we speak a lot about. Siblings, everybody, like, you can buy little stuffed animals even in our gift shop, and they rest great in the crib, but nothing in the crib. So we speak to absolutely zero in the crib. And again, if a sibling puts it in there, it's just educating everybody about the safeness that we need to have, the safe sleep environment.
And again, that's important because if there's things in the crib, what are we worried about happening?
So you actually don't want, again, pillows, blankets, stuffed animals, anything loose for the risk of suffocation. So really, less is best. And it's difficult because for us to teach these things, because when expectant parents go to stores, you see all these crib displays with bumper pads and with all the bells and whistles. And then when they come to us, they're often very surprised that the crib really should look as it does now. Really, nothing but a fitted sheet and the baby with either a swaddle wrap or one of these wearable blankets, as we also call them, or swaddled with just one blanket. So really, babies don't need much more clothing than you and I would wear. And a lot of people are surprised by that. We're also recently teaching to the fact that babies shouldn't really wear hats while they're sleeping. So a lot of times if you were to walk by a nursery, you'd see babies with hats on. After their newborn bath, a hat is okay for the first 24 hours, but after that, we actually want to model what we want the families to do at home. So we really wouldn't recommend them to have their baby sleep with a hat at home, so we don't want to show that to them in the hospital, again, beyond the first 24 hours
So
after the bath.
a baby can actually get too warm, right? I mean,
Exactly, they can
especially in the winter
overheat.
months, you feel like, oh gosh, it's cold. You need to wrap this baby in.
And overheating is a risk for SIDS.
Oh, it is.
So an
Yeah.
ideal room temperature is about 68 to 72 degrees, whether it's wintertime or summertime, so you must have to take that into consideration too. But an overall statement to say a good room temperature would be 68 to 72. So again, not much more layers than what you and I would need.
And how long, as long as the baby's in the crib, you want to do this? Is there a certain age where some of these things maybe go away a little bit, or?
I would recommend, I mean, for certainly the first year.
Yeah.
And even beyond that, I think at that point, if you've gotten to the first year without all the bells and whistles, I wouldn't recommend going back to any other habits. So,
And remember to starting to unswaddle about 2 months of age, getting those arms free.
yes, yes.
Okay. Great. Now, some of this also translates to car seats, is that right?
That is right.
Yes.
So the same theory goes for car seats as does the sleep environment. Less is best. So that's just kind of a blanket statement that I put out to all the families that I come across, that really, if it doesn't come with the car seat, it shouldn't be added to it. So really, as it comes out of the box, is how the baby should be maintained in that seat. So if it comes with a head insert, great, you can use that because it's been tested and approved by that company. You really don't want to, again, you can go to many baby stores and you'll see all sorts of head inserts and things that would go behind the baby or over. So what I actually have here today is I have a crib. I have a
We have a car
car
seat.
seat.
Car seat.
Excuse me, I was still
And
talking about
we're going to show
cribs.
the wrong way to do
Yes.
this.
Yes. So, so if I could actually have
Want
my
the baby
my
back?
Yeah,
girlfriend
baby.
back here for a moment, I'd like to
Sorry,
show
babe.
you what if she was to be in her seat improperly, what it would look like. So, if I could pass you these items, that would be great.
Absolutely.
Thank you. So, oftentimes we see families that are going home from Little General may have the baby ready in the car seat, and they call for the nurse to come check the setup. And we may see something like this, where at this point, if you were to look, you can't even see the baby in this type of covering. So that is something, especially in the winter months, we really feel the need to teach to it more, because a lot of families will think that the babies will get cold if they don't cover. But this is really poor ventilation, so you really don't want a blanket coming up and covering the whole car seat. There's certain inserts that come in car seats that go behind the baby's back. We don't want those either. But just to speak to something on top of the crib, on top of the car seat.
Sure, thank
We
you.
want to take that off. So if I could pass you that as well. So also, I can actually even pick it up here on my lap. I don't know if you can see that very well like that. But if she was to be buckled here in her car seat and have this headrest around her that did not come with her seat, this would be a bit of a no-no. So a lot of families think that the newborns, they don't have good head control, which is true. They gain head control as they get older, and they do that very quickly. But we really don't want to put something in the car seat that would support the head and neck if it didn't come with it. So this would be a no-no as well.
Another one.
So what I have here is I also have a blanket that is behind her. So you wouldn't want a blanket behind her. Again, nothing behind the baby. So it's just them and the back of the car seat. So that would be extra bulk. That would be unnecessary. So I'll pass you that as well. We also actually have these toys that are dangling from here, and I know you can see these in a lot of stores as well. So these actually could become projectile if in an accident. If they're long enough, they could also be a strangulation risk. So there really shouldn't be any toys that hang on to the bar just as such. A lot of people don't realize that car seats have an expiration date. So you should always check. There's usually a sticker on the side. If not, it may be written in the manual. And if you really can't find it, you should go to the website of the manufacturer of the car seat. And a lot of car seats expire around 6 years, but some go up to 9 or 10. So it's always important to make sure. We just don't know what happens to the integrity of the plastic.
Okay.
You also want to make sure you don't get a car seat from a source that you're not aware of, a used car seat at a yard sale. You just, again, if you don't know the history behind the seat, you really shouldn't be borrowing.
I know another good idea, just from experience, you can usually go down to your local police station. They'll make sure it's
Yes.
secured in there, right? Which, if anybody's ever done a car seat, it can be a challenge when you first do it to get it in
It
securely.
Very much so.
So if it's a cold day and you say, well, we don't want to put anything in the car seat, but it's freezing cold out, how do we keep our babies comfortable?
And that's such a great question, because it comes up with everybody in the family. It's 0 degrees outside. What are we doing? So you have to think. You'd warm up the car before a baby would go into it anyways. The baby's in the lobby of the hospital, you pull the car up, you put the baby in the car seat. So the temperature is maintained, it's a warm car. You sometimes will see those big fleece coverings that zip up over the baby. Again, that's another no-no that we see all the time in the winter. and or snowsuits. If it's snowing outside, they think the baby's going to play in the snow. So these are all teachable moments that we speak to, and what we say, especially those fluffy down snowsuits in a car seat. I always say the baby needs to come out of that there's been car seats tested where the baby's in the snowsuit, but the straps are on the snowsuit, not as close to the baby as it should be, and the baby is projectile out of the snowsuit, but the snowsuit has remained. Wow. So when I say that to the patients, they're like, okay, we'll get it off right now. Yeah. So I think it's important to just constantly teach and know that you're not going to bring the baby out when it's that cold out. You're going to warm the car up if you were going to the pediatrician's office. Really, those fleece snowsuits, those fleece coverings where they just show the baby's head, if you're pushing the baby in a stroller, that's a wonderful time to do it. Baby's not in a car seat, you're pushing the baby for a walk, really the only time it should be used.
Okay. Sort of something I thought of too in terms of the baby sleeping. I know prone sleep. I think it's gone back and forth over the years of whether a baby should sleep on their back or their front, and the thinking now is prone sleep, right?
Yeah.
Supine.
Supine, excuse me.
So supine means on their back.
Okay.
So prone is what we would not want them to do. So
gotcha,
prone is face down, and supine would be on their backs. So yes, always, every single time, whether it's nap time, going to sleep for the night, baby should always sleep on their backs. However, to balance out all the back sleeping, supervised tummy time is fantastic. It's wonderful for them developmentally, and it can be offered as young as the first day of life. So when you find that the baby has been fed and changed and quiet and alert, that's the best time to offer supervised tummy time. So again, you can offer it as early as being in the hospital when the baby gets fussy, and that's baby's way of letting you know that he or she is tired and has had enough. You can do it up to 3 to 4 times a day, and as they get older, they'll tolerate it for longer periods of time. But it's so important for them to strengthen all the muscles in their upper neck and back, so when they become rolling over age, they have the strength and know-how of what to do with their head. So
a good technique that you've actually taught me about, Amy, is those moms that get the comforters for their shower, or somebody makes a beautiful quilt, or even the pink one that we had here, that can be used for a tummy time blanket. So they're still using it, but just not in the crib.
Not in that way.
Yeah.
Okay. Now, in terms of safe sleep, do you feel like is there anything else that you guys would want to mention?
You wanted to mention one thing about the car seat?
I did. If I could just go back to the car seat briefly,
yeah.
And Laura had mentioned really one layer of clothing is best. You actually want the clip, the chest clip, if there is one, and I believe all car seats now have the chest clip. It wanted to have that mid-chest, so not too high up by the neck, not too low down by their belly. So one layer of clothing, the buckles, but they also want to be cognizant of where the straps are coming out of the back of the seat. You'll notice that a lot of car seats will have several different slats of where the straps can be threaded through. So this one, for example, has 3 different slats of where you could thread the straps as they get bigger. So really, parents should almost constantly be, every time they put their infant in the seat, because they grow so quickly, thinking, are the straps at the right height?
How do you know?
So what you want is actually at or below the level of the shoulder. You never want them coming from above, because it gives them some wiggle room. So you don't want them up too high and coming down at an angle. So at or below, kind of up and over like a rainbow, but not to be higher up, because it gives them too much wiggle room. So really, parents should always be checking those straps, adjusting, as they grow so much. So.
I know one thing we had talked about before is something, obviously the parents are going through a lot in that initial time. They're short on rest and things, and we talk about purple crying.
Yes.
Can you tell us a little bit about what that means and what that's about?
Sure. Period of purple crying we initiated about a year ago. I think we rolled it out. Again, another educational piece for our staff as well as families, and it's really teaching parents what to expect with their infant when they go home. Crying is normal. And parents can get frustrated and stressed, and as well as caregivers, and we want them to know it's okay to put the baby down in a safe environment and to walk away. And babies peak crying. What studies have found is that babies peak around 2 months of age, or 6 weeks of age. 6 weeks. I'm sorry, 6 weeks of age, and then start to slowly subside around 3 to 5 months. So it will peak, but there will be an end to it all. But I think educating parents that this is normal, this is what is expected, is a good piece.
It can be up to 3 hours a day at 6 weeks of age. So it can begin at 2 weeks, peak at 6, and should slowly have come down by 12 weeks of age. So maybe a lot of babies that are misconceived to be colic babies are babies that are just maybe showing typical newborn behavior at that 6-week mark.
Right,
So, so a discussion with their pediatrician is always a good idea.
Well, it's all great information. Is there anything else on those topics you guys would want to add?
I would like to say that at our hospital we have lactation consultants that are there 7 days a week, and I know breastfeeding is best for our babies. And we always want to support that, so we have our lactation consultants there to support, and all of our nurses are lactation advisors, so they're well educated in the field of breastfeeding also.
And that's another thing that can be very frustrating.
Whole
for a
nother
new mom.
story on that
Right,
one. Yes,
right.
yes.
Well, I mean, and that's worth sort of mentioning as well, is that Lowell General Hospital, the maternity unit, is a busy place. How many
Yes, it
babies
is.
a year?
We have about 2,500 deliveries a year.
That's amazing.
It is.
When you think about, what is that? I can't do the math quick enough, but it's a lot every day. I mean, it's.
It is. It's about 200 a month is what it averages out to be. So.
But obviously, it's an amazing place to have a baby. I know. Can you maybe just briefly tell us why it's such a good place to?
Sure. The mother and infant unit is a 22-bed single room for all of our moms, single patient rooms, and then our labor and delivery room is brand new, 3 years old, state of the art.
Tower?
Yeah, new Daha Tower, which is great. Again, all of our staff are experienced nurses who love what they do. And again, we are focused on the family-centered unit and really teaching everybody, and we all embrace that concept.
We also have a level 2B special care nursery for our babies that may be a bit premature or may have had some difficulties at the time of delivery. So that's actually a 10-bed unit, and our affiliate is Tufts New England Medical Center. So for the babies that need maybe a little bit more than what our nursery can provide, our staff and physicians have the ability to stabilize that baby until the baby can be transferred to Tufts.
And I think a lot of people think, you have to go to Boston to get all the state-of-the-art care and experts in their field. That couldn't be further from the truth. And to be able to have your baby close to home, to be able to have your family be able to visit, can make so much of a difference for families.
It's good for the bonding for mom and baby and not driving into Boston and the added expense of Boston. So as soon as those babies are well enough, we can get them back out to Lowell. We absolutely do. And we embrace that. We have parenting rooms for our moms. We encourage boarding so that moms can stay if baby is out and special and mom isn't a patient.
Lowell General's saying is put patients first in everything we do, and it's a theme that goes through the whole hospital, and no doubt your department as well. So thank you guys so much for all of this. This was, I think, really helpful for new parents who are trying to figure all of this out. Thank you everyone for joining us today. Thank you both for coming,
Thank you.
and we'll see you again on Full Circle Fitness.
The preceding program was sponsored by Circle Health Complete Connected Care.